Hey there, and welcome back to another episode of the Sports Medicine Midwest podcast. I'm your host, Dr. Seth Myers, a sports chiropractor in Salina, Kansas, and this is a special edition of our podcast in the sense that we were doing both video and audio. So if you're listening to this, just know that there is video of this somewhere out there, whether that's on Facebook or YouTube. And really all the video is just a screencast of what I'm talking about, because I'm going to mention a couple of resources that I think are great for the topic we're talking about. And so this is kind of the first, I guess, official episode where we're actually talking about something. And so I figured I would start out by talking about how to choose a provider. So I'll just dive right into it. So there is a resource that I think more people should know about when choosing a provider, and that is called choosingwisely.org, or Choosing Wisely is the name of the campaign. So in brief, the Choosing Wisely campaign was started by the American Board of Internal Medicine, and long story short, they collectively are trying to get different areas, societies, and groups in the medical field to put out recommendations, best practices, things of that nature that can be patient-directed and provider-directed to some degree, but that way patients can look at these recommendations and kind of cross-reference that with the provider that they are seeing and make sure that they have chosen a good provider. That's kind of the name of the campaign itself. So as a patient, or if you've got any medical concern whatsoever, you should be able to go to choosingwisely.org, type in either kind of the general thing that you are going to be seen for, or the specialty that you're looking at. So, for example, oncologist, pediatrician, orthopedist, things of that nature. And you can see some of the recommendations and guidelines that they have put out for whatever they think needs to be done. And so, I know that's very broad, but you'll see what I mean in just a second. So, I'm on the website here. I'm going to, let's say I've got foot pain. So I'm probably going to go see a podiatrist because my foot's been killing me and I want to figure out what's going on. So as a patient, what I could do is I could go to this website before I ever go to see a provider, and I can click on this For Patients tab. So if you're just listening along, there's a Patients tab at the top. So if you're going to be a patient for something, that takes you to a separate page where there is patient resources listed out, where I can click on and get different information. So taking medicine safely, cervical cancer screening, imaging tests for colorectal cancer, hearing problems, just everything. And there's tons and tons and tons of this information. But there's a search bar, and so I can search by keyword, or I can pull up a specific kind of specialty that I'm looking at. So the American Academy of Orthopedic Surgeons. So if I needed an orthopedic surgery of some sort, I can look and see if they've got any recommendations that cross-reference with the thing that I'm going to be seen for. American Academy of Pediatrics. Again, kind of everyone has, or should have, that's kind of the whole goal of this Choosing Wisely campaign, is some recommendations, best practices that providers should be doing, and patients can cross-reference with their experience at the provider's office to make sure that they have chosen a good provider. But I can also filter by specific category. So if you're listening along, you can't see all these, but there's categories here that range from brain to cancer to ear infection to headaches, heart health, but there's a foot care tab. So again, I'm using the example of me having some foot pain. I'm going to click on that, click search, and there is a treating plantar fasciitis tab that I clicked on. And so now I'm on this page, treating plantar fasciitis. So I might not necessarily have plantar fasciitis, but I can see that there's something for foot pain. I could read through what plantar fasciitis is very quickly, how they would go about diagnosing it if I was in someone's office, and then some suggestions from the doc in terms of actual treatment. And so, again, if I was a patient concerned about who should I go see for this, what I could do is see what recommendations on this page are, which these recommendations specifically are coming from the American Orthopedic Foot and Ankle Society, so very well respected. And I could kind of cross-reference that with the podiatrist that I pick in town. So let's say my friends recommend Dr. Joe. I could go see Dr. Joe, and if the things that he does line up with what I'm reading here, I could feel very confident that I'm in a good place. If I go in there and, the treatment that he offers is way off the mark for any of this, not to say that that's wrong, because he could be cutting edge or whatever, but, I might just be a little concerned. Or, as a patient, if I was really doing my homework, I could have read up on different treatments, and I could ask, hey, what do you think about this treatment? I saw it on choosingwisely.org. Do you think it's a good treatment? And, go from there. So again, I think this is a great resource. Choosing Wisely is the name of the campaign, choosingwisely.org, and trying to find the specialty that you might be looking for to help answer or point you in the right direction of things that you might need taken care of. So conveniently, there is a list of 5 different recommendations from the American Chiropractic Association. So I know this says chiropractic. I know I'm a chiropractor, but I would say these recommendations are more broadly for low back pain. So it doesn't necessarily matter who you're going to see as a provider, whether that's your family medicine, general practitioner, even an orthopedist, or physical therapist, or chiro. These recommendations are pretty well established across the board for things for low back pain. So again, I know it says chiropractic, but trust me, these are, again, more broadly for things with low back pain. So I'm going to read them and go over them very quickly, and hopefully we can give you guys some good information about this. So number 1, avoid routine spinal imaging in the absence of clear clinical indicators for patients with acute low back pain for less than 6 weeks. So what does that mean? That means if I have had low back pain for about 2 weeks, I'm going to see my provider, doesn't matter who it is, like I said, GP, physical therapist, orthopedist, chiro. Standard practice, or what we would recommend, is you don't necessarily need an image that day, whether it's X-ray or MRI, to help you with the diagnosis. There's some caveats to that, like if we are suspecting cancer, infection, recent trauma like a car accident, if we think there might be a fracture. But if I've got, my back started hurting, it's been 2 weeks, and haven't had anything crazy happen, taking a picture doesn't seem to help us with getting better outcomes. I really wish it did, because then that would be very easy. We could take a picture and be on the right track right away, and our outcomes would be awesome. But again, the reality is it really doesn't help that much. If anything, it might even hurt, because now we might be barking up the wrong tree. Anyway, that's a really big one, is we don't necessarily need a picture right away. So if your provider takes a picture just because you tell them you've got low back pain, I might be not necessarily concerned, but they might not necessarily be following best guidelines by taking a picture that day. Again, every case is different, but if that's their standard practice, is to take a picture every single time someone walks in with low back pain, you could probably find a better provider. Let's move right along to number 2, which is actually kind of a follow-up to number 1. It says, do not perform repeated imaging to monitor patient's progress. So that kind of is what it sounds like. If we take a picture today, and then we were to take a picture in 6 weeks, using the picture itself to help monitor how we're doing as a treatment plan doesn't show any great outcomes at all. So, and there's multiple reasons for that, but imaging can be very tricky. We've all heard of a friend who maybe had something hurting, they went in to get a picture, and the picture looks normal. Well, if the picture looks normal, how come they have pain, right? And so that's one of the reasons why using imaging to monitor the progress isn't great. The other reason, too, is we can see some really nasty looking things, but patients report very little symptoms. So if they're feeling good, but the image looks a little wonky, and you're still treating them because the picture looks bad, but they don't have symptoms, that doesn't necessarily correlate clinically either. So we got to be cautious of that. And if that's kind of the standard practice of a provider, I would say, hey, you'd probably be in better hands by seeing someone who doesn't practice by using repeated imaging to monitor their progress. Let's move right along to number 3. Avoid protracted use of palliative or passive physical therapy modalities for low back disorders unless they support the goal of an active treatment plan. So that's kind of a mouthful. What does that mean? So we should avoid using, for long periods of time, the passive care treatments such as e-stim, ultrasound, heat, cold, those things where the patient is basically lying there passively and not necessarily taking an active role, so doing some sort of a stretching or mobilizing, doing some sort of corrective exercise, because the research time and time again has told us that for low back pain specifically, getting patients active, doing some corrective exercise is really, really helpful. And so these passive things can be good short-term for pain, but long-term, I would want to be a bit more active with patient care. So again, if the provider is consistently every single time you come in doing the same kind of passive things and not shifting towards an active treatment plan, that is something that doesn't necessarily line up with some of the best recommendations right now. Number 4, do not provide long-term pain management without psychosocial screenings or assessments. So this is a kind of a can of worms. I'm not going to get into it too much right here. Basically, if someone has had pain for a long period of time, something that we should do is consider some other factors that might be leading to that pain. So sleep habits, is life super stressful right now, eating habits, other things outside of just the mechanical factors can lead to there being more pain. I'll kind of leave it at that because it's a bit more specific to just treating patients in the office and not, something to talk about over a podcast. But number 5 would be do not prescribe lumbar supports or braces for long-term treatment or prevention of low back pain. So again, this is just one of those things where conventional wisdom would tell us, hey, a support sounds great and should help us prevent some low back pain. But if we look at the research, there's not really any great data that tells us that using a brace is better than not using a brace for preventing low back pain. But then we also tend to see if you use it long term while you're dealing with low back pain, outcomes aren't good for you either. So we would be much more supportive of trying to shift towards you getting to stabilize on your own, using your own muscles, things of that nature. And so again, long-term use of braces are not necessarily recommended. So again, those are kind of the big 5 recommendations, mostly about low back pain and treating low back pain. And I'm going to kind of toss in some of my own opinions also for choosing a provider. So I just put a list here. I'm not going to spend too much time talking about them. But number 1 for me would be looking for a provider who practices evidence-based medicine. So in a nutshell, what that means is I'm not just using my clinical experience to make judgments on what we should do for treatment. I'm using also what the best science says. So you typically as a patient will be able to pick that up if the provider you're seeing is kind of citing, hey, we have this research that tells us X, Y, or Z for best treatment for this condition, diagnostics for this thing, things of that nature. But evidence-based medicine is something that's high on my list for trying to pick a provider. The next thing that I would look for is someone who, for what I do specifically, includes a lot of active care and rehab into the treatment. So the hands-on care can be awesome, but we want to make sure that at some degree, whether it's low back pain, shoulder pain, neck pain, that we're getting some active care into the treatment plan, which kind of is a good segue into the next one. Is I want to make sure that I'm finding a provider who spends quality time. And so if you're coming in and out of the office in 5 to 10 minutes, there's nothing necessarily wrong with that. I just feel like we could have a better, more well-rounded treatment plan if we had longer appointment visits as a whole. And so, that could mean whatever it is to you, but just making sure that we are able to incorporate some active care by spending a bit more time with the patients. Another one for me is looking for a provider who is familiar with activities that you want to do. So if you are, let's say, a basketball player and you get hurt and you want to get back to playing basketball, well, it would be nice if that provider had some knowledge and experience with basketball. Obviously, you're not going to find, an NBA player who's able to treat the conditions you're dealing with if you're a basketball player, but to some degree, I think it's nice to be able to talk with the person that's treating you so they can help get you back to the thing you like to do quicker. And then one of the last things that I like to add is looking for a provider who has multiple tools in their toolbox. So basically what I mean by this is it's not just a one-size-fits-all treatment, and they don't do the exact same treatment for every single patient. So having multiple styles of being able to treat is something that I think is very handy. So that kind of makes up my entire list. And if you've got any questions, concerns, or anything, by all means, feel free to reach out to me. That's been first episode. Thanks for listening and take care.